Hi, my name is Dr. Vishnu Sreenivas. I am a general practitioner with more than 5 years of clinical experience, with expertise in acute medicine, then chronic lifestyle diseases like hypertension, diabetes, and hypothyroidism, and also emergency and critical care. Today I am here to give some clarity on the topic, that is viral respiratory infection and the role of antibiotics. Because in my OPD, the most common case I am coming across is the respiratory infections, and out of this 80% of the infections are due to virus only, not because of bacteria. And the people, like the patients, are frequently requesting me for the antibiotic prescription, and I will educate them the difference between the virus and the bacterial infection, and what are the pros and cons of the antibiotics, and also when you need the antibiotics. And then they will tell me like, okay doctor, we won't need the antibiotic right now, we will wait for a few days, and if symptoms are not persisting, we will come after and proceed with the investigations and all. Today I am here to give some clarity on the topic, that is acute viral respiratory infection and the role of antibiotics. Because the most common case I am coming across in my OPD is the viral respiratory infections, and about 80% of the infections are due to virus only, not because of the bacteria, but the patients are frequently asking me for antibiotics. Actually, the antibiotics are designed to kill the bacteria, not to kill the virus. And if you are taking antibiotics against a viral infection, it is like using a key for the wrong lock. It simply will not open the door to recovery. Actually, it is the most common misconception the patients are having. The greenish discoloration of the sputum is not because of the bacteria, it is actually because of the WBC, that is the white blood cells in our body, which fights against the pathogen, that is maybe virus or can be bacteria, and it will fight against these pathogens and produce some enzymes which has iron content, and this causes greenish discoloration of the mucus. But if you experience this, it might mean that the simple viral infection has shifted to some serious infections or some secondary bacterial infection. There you may need some antibiotics, but before that you have to consult your doctor. So in most cases, the viral infections are self-limiting, because the natural life cycle of the viral infection is around 7 to 10 days only. So having antibiotics against the viral infection is not necessary. It will not prevent the complications, but sometimes it will kill the friendly bacteria in our body and may lead to gastritis, loose stools, and sometimes end up with antimicrobial resistance, and in future the antibiotics may not work for you. The unnecessary antibiotic will not prevent the complications, and it will sometimes kill the friendly bacteria in our body, and you may have some symptoms like gastritis, loose stools, and sometimes end up with antimicrobial resistance, that is tomorrow when you need the antibiotics, it may not work for you. As I mentioned, the viral infections are most of the times it will be like self-limiting, and the improvement after the antibiotics doesn't mean that antibiotics always helps. It is because of the immunity of our body which fight against the virus, and we are getting relief from the disease, not because of the antibiotics. As I already mentioned, most of the viral infections are self-limiting, and the improvement after antibiotic doesn't mean that antibiotic was necessary, or it doesn't mean that antibiotic always helps. It is our immune system that fights against the virus and kills them. As a doctor, I will look into some specific clinical markers which suggest that the bacteria has taken over. This includes duration, that is we can follow 10 days rule. That means if you have some symptoms and it is not getting subsided or it is worsening after 10 days, then you may need antibiotics, you have to consult your doctor. The other one is like double sick phenomenon. That means you are having some mild or moderate symptoms and it will last for 2 days and it will subside after 2 days, and then you are suddenly having high-grade fever or cough with a sputum. This means that you are having some severe infection or some secondary infection. Here also you may need antibiotics. Before taking antibiotic, you have to consult the doctor. And we also prefer antibiotics in some high-risk people who are prone for the secondary bacterial infection, like elderly people and people with end-stage renal diseases and some immunocompromised diseases, and also patients with chronic lung diseases and severe asthma. In such cases, we also prefer antibiotics. My take-home message is that if you are suffering from some infections, make sure that you consult your doctor and get prescribed by your doctor and follow the orders. Do not self-medicate, because the misuse of antibiotics today may lead to antimicrobial resistance, and it may not work in future when you truly need it. So I believe that I have given you a basic idea on the respiratory infection, that is viral respiratory infection, and the role of antibiotics in it. If you want to know more or want to consult with me, I am Dr. Vishnu Sreenivas, working as a general practitioner, NMC Medical Center, Rolla, Sharjah.